Yes, thank you so much for the co-chairs of this session. And I would like to take the opportunity to introduce the next speaker, which is David Walker. He is talking about the subject of family, patient and family perspective.
Good afternoon, ladies and gentlemen. Let me introduce myself. I'm David Walker, Sam's husband, and never in my wildest dreams did I ever think I would be given a presentation about how I lost my wife to cancer. So please bear with me. My wife Samantha passed away to cholangiocarcinoma in May last year. She was just 37 years old. I would also like to take the opportunity to introduce you to my best friend. He is our son, Logan. He is coming up to 2.5 years old. He is one of the many reasons why we must find a way of detecting CCA sooner, and thus hopefully increasing survival rates. How can it be right for this little boy to have to grow up not remembering his mummy? This, unfortunately, is not a story of hope, but one of the harsh realities of life, and it is worth sharing, and is Sam's story. In September 2023, Sam started to feel what she thought to be a pulled muscle in the stomach area, but put it down to just new mum pains, having given birth to Logan some months earlier. Sam went to the doctors, who thought it could be long COVID or gallstones, but it just didn't clear. Sam revisited and saw a new doctor who said that things just didn't add up, and Sam was put onto the 2-week cancer pathway. On Monday, the 27th of November, we'd been called into an appointment at Dartmouth Valley Hospital in Dartford. As we were called in, Sam noticed the Macmillan lanyard around the nurse's neck. Sam knew immediately that it wasn't going to be good news. She was totally right. Looking back on that 30-minute appointment, it was a total blur, and it blew our totally perfect world apart. The nurse explained that the numerous blood tests and scans had detected what they believed to be a cancer in the liver area. We left the appointment speechless, not knowing what to say to each other. Sam's case was referred to the King's MDT team for review, and she was sent for a PET scan on the 7th of December. Those results were not available until after Christmas, which obviously made for a very nervous time whilst trying to make the most of our Christmas break together. An appointment with the oncologist followed on the 4th of January, and Logan came with us just to try and keep us as normal as possible. Our very first worst fears were confirmed. The PET scan had confirmed the cancer, and what more, it was a 13-centimetre tumour. To hit us even further, it was deemed inoperable as it sat over both lobes of Sam's liver. A prognosis of 12 to 18 months followed, and Sam was put onto the palliative care path of treatment. I'm sure we will all agree that is a dreadful sounding phrase. Devastated just doesn't come close to how we felt. I know how I felt mentally to this day, but to this day, I've not got a clue how Sam dealt with this news. She just continued to be her positive self and not letting it affect us and the family. It was always about what we were feeling as a family, not about how she might have felt. Sam truly was an amazingly courageous and inspirational wife. Personally, I can just remember feeling numb in the days, weeks following the prognosis, not wanting to believe it was true. Reflecting on this, it was clearly just the shock of it all. I never at any point felt as though it was going to end with us losing Sam. It was always a case of staying positive and believing that the medication would work and reduce the tumour sufficiently enough for surgery to be a possible option. Sam's chemotherapy and immunotherapy treatment started at the end of January. Sam suffered a blood clot in her lungs in mid-February, for which she was prescribed blood thinners. The treatment continued with no other real side effects, but was that because the treatment just wasn't working? I was especially grateful to work who allowed me to be able to attend every appointment and also take Sam to and from all the chemotherapy sessions. I didn't want it any other way. I wanted to be with her every step. I also wanted to do everything at home so Sam could rest and recover. This, however, did lead to some frustration from Sam, as again, she just wanted to carry on as normal. Who was I to argue with her? I had to acknowledge Sam's way of dealing with this and had to take a step back at times. It was, however, just horrible to see her in the amount of pain she was. Sam suffered a lot with a trapped nerve in her shoulder, and this was down to the tumour pressing against the nerve, one that was clearly causing Sam tremendous pain. Sam had a mid-treatment scan in April. The results showed that the treatment indeed hadn't worked. Even though there was negligible growth in the original tumour, it showed that multiple new tumours had developed. Sam suffered a stroke a week later, and her health spiralled quickly downhill. Sam was admitted to the amazing Eleanor Hospice on the 9th of May last year and passed away peacefully with her nearest and dearest by her side on the 23rd of May. That is the sad story of Sam's CCA journey, one that every one of us in this room would change in an instant if they could. I would now just like to give you a little bit of an insight into Sam as a person. Sam and I had met in the summer of 2016 at the cricket club that Sam worked at and I played at. I was instantly attracted to Sam's zest for life, her fun personality, and her most amazing of smiles. We spent many a day, weekends and holidays together with our dogs, just enjoying the simple things in life. We subsequently married in September 21, and we were overjoyed when little Logan was born in December 22. We couldn't imagine life being any more perfect than it was then. Sam was just so selfless. Nothing was ever too much trouble for her. She was always going out of her way to help others. Her life was never about her. It was always about her family around her. Even through Sam's cancer journey, it was never about her. She would always worry and talk about what we were feeling as a family, as she thought it must be worse for us to see her struggle at times. I know that during Sam's journey, she was a constant contributor to the AMMF Patient Forum and helped many a patient from around the world with her words of kindness, empathy and advice. I also believe it helped Sam express her feelings without having to upset her family. The forum is absolutely invaluable and a credit to the charity. I'm sure Sam's courageousness showed through and was inspiring in itself. One of Sam's biggest achievements was completing the Couch to 5K in lockdown 2020. This quickly became Couch to Marathon in 18 months, as we both completed the London Marathon in October 21, less than a month after we were married. All of this after Sam told me quite clearly shortly after we had met that I would never get her near a pair of running trainers. Sam had suffered for many years with mental illness and the self-doubt that comes with it. Yet she set her mind to it and challenged herself both mentally and physically and absolutely smashed it. Sam became a new confident person through this journey, and that stunning smile shone through endlessly. I was then, and remain still, so proud to be able to call her my wife. She has become such an inspiration for her family and friends. It felt fitting that we should arrange a charity cricket match in Sam's memory. This we did in August last year. We were truly overwhelmed by the media coverage this generated and was covered on BBC South East as well as the article in the Metro newspaper shown on the slide. It was a testament to Sam's story and it was heartwarming to raise such awareness for this cruel disease, and to also be able to raise in excess of £22,000 for IMMF. I'm sure that Sam was looking down on us that day, and so proud of everyone involved. I will be continuing to raise funds in Sam's memory by running the London to Brighton Ultra Marathon on the 23rd of May next year, 2 years to the day that Sam lost her heartbreaking battle. We, as a family, are also committed to continuing the work to raise awareness of cholangiocarcinoma through other fundraising events, such as monthly quiz nights and other physical challenges. If we can stop just one family having to go through what we have for the last 18 months, then it will all be worthwhile. I'm going to conclude with my call for action, and that is to stop recurrences of this image. How did Sam, a fit and healthy 37-year-old, go from 0 symptoms to the shocking image of this 13-centimetre tumour in just 6 to 8 weeks? How can cholangiocarcinoma be detected earlier? As we know, early detection and diagnosis is the key to all cancer, as it clearly gives the patient the best possible opportunity of surgery, treatment, and ultimately survival. Thank you for the opportunity of telling Sam's story. Thank you.
Thank you very much, David, and I think I speak for everyone for just saying thank you for sharing such a touching story, which I think many of us in the room are familiar with, and thank you for your efforts in supporting the work of many people in this room as well. We are going to break for lunch now. We've got an hour's break. The lunch will be out by the wine tower in the main hotel, and we're going to come back at 1:40.
Almost 1 in 2 people will get cancer in their lifetime, making it one of the biggest health burdens faced by the society. Fortunately, the combination of science, new data, insights, and innovative technologies are paving the way for a new era when cancer outcomes can be redefined. At AstraZeneca, we have a bold ambition to harness this power and to one day eliminate cancer as a cause of death. To turn our ambition into reality, we need to deliver on the scientific promise of so many exciting developments in the cancer care space. Together, we can strive to one day eliminate cancer as a cause of death.